waiting?
Every day, more than 200 people visit emergency via the busy triage station. This evening, Nurse Julia Hoyles is working the desk, assessing patients and prioritising who gets seen to first. She's been an emergency nurse for 5 years.
Just behind that purple line.
I like doing the triage. It's one of those places where you never know what you're going to get on a given day, and it's full of chaos, and that's what I love about it.
What's up?
I've had enough waiting here, love.
I know.
With so many people needing attention at the moment, Nurse Julia is dealing with increasingly agitated patients.
We're doing our best to get you in, okay, but it's pretty busy today.
Well, why did you bother me? You got so many things to do.
I know.
How do I
Hang
thank
tight,
you?
just be patient a little bit for me while I see if I can find a room, okay? Yeah? Very good. I'm just going to do a quick sweep around, make sure no one's left.
With beds in short supply, Julia is checking if any patients have vacated valuable spots.
The extra spare beds. I got very excited, but some of them need flood washers, so there'll be another 20 minutes or so before we get use of them.
It will take just hardly 60 seconds.
I understand that, but something like a tetanus injection isn't the highest on the priority, so we will get to it when we can.
No, so you're saying tetanus is not a serious thing?
Not a life-threatening emergency in the next 5 minutes.
But just as triage is becoming overloaded, security cameras show a potentially critical situation unfolding. A nurse sounds the alarm, and emergency staff rush to a woman who's collapsed at the triage window. The cause is unknown. Emergency physician Dr. Michelle Thornhill reacts to the alarm immediately.
When a buzzer goes off, we all know what that means. It means someone's in distress. So we all look outside the cubicle, see where it's happening, and I'm the closest doctor there. So I stop what I'm doing and I run out to the waiting room to see what's going on.
1, 2, 3.
I find a young woman in convulsions. So I immediately run to her assistance, support her head. I'm thinking she's having a seizure.
Have you got her?
Yeah, I got her. So a seizure can last anything from a couple minutes up to more than 15 to 20 minutes. If it goes longer, she's at risk of not breathing properly, not being able to swallow and choking.
Before she started convulsing, the young woman told staff she'd been having seizures earlier in the day.
Okay. She had 2 seizures today, witnessed by a friend. And then this is all I heard.
Okay.
And then we pressed the button.
The young woman is coming out of the seizure disoriented and confused.
Absolutely need to get some blood tests.
You're at the hospital. Can you hear me?
I'm Michelle, one of the doctors.
You're okay. It's all right. You're just at the hospital.
Thank you,
Jessica.
Jessica is a student from Chicago and right now probably feels a long way from home.
I'm starting to check her vital signs.
Sorry, Jess. Just open your eyes, all right? Just doing a big thing.
I get the nurses to attach all the monitors to her. I make sure that she's breathing well and getting enough oxygen. And then I start doing my investigations. So I take blood tests and order CT scans. Can you tell me what medication you're on for seizures? Do you know? Which ones are you on?
Jessica's having difficulty speaking because she's bitten her tongue during the seizure. So it's hard to get her medical history.
Just relax. Stay nice and still. I'm going to take a tracing of your heart, okay?
Okay, was that your friend that brought you in? Yeah? Okay.
Jessica came to hospital with her friend Sarah, a German exchange student.
So we were in her room and she had an issue before. We're just waiting and then I called her mom and she said maybe it's better when you go to the hospital and then we came here.
Do you got something for this?
Both young women are far away from family and have bonded quickly.
What's the code?
So I'm just since 5 weeks here in Melbourne, so I know her since 4 weeks now.
While Jessica gets support from her friend, Dr. Michelle is still concerned that the cause of the student's seizures remains a mystery.
Right, I want you to just squeeze my fingers for me. As tight as you can, squeeze both sides. That's it.
2 hours ago, 20-year-old Jessica, a student from Chicago, collapsed in the busy triage waiting room. It was her 3rd seizure for the day. And alarmingly, doctors still don't know what's causing them.
Did you have any headaches or anything today?
Jessica bit her tongue during the last seizure, making it hard for Dr. Michelle to get the information she needs.
Do you know when's the last time you had a seizure? Before today? 8 months ago? So seizures are totally draining on a person having it. It's their whole body that's convulsing. So practically every muscle in their body is going into spasm and out of spasm repeatedly for minutes on end. They're really tired, they're sore all over. Probably akin to someone who's just run a marathon and have used every last bit of energy that they had, and then they collapse at the end because they just have nothing left.
Jessica was brought into hospital by German exchange student Sarah. Both young women are far from home, and it's times like these Jessica needs a friend like Sarah.
I come from the Caribbean. I can definitely relate to being on your own. I mean, I came out here essentially on my own. So yeah, I do know how important it is to have people who care about you close by. And if those people aren't around, then it's good to have other caring people there who can offer you that sort of reassurance and comfort in your time of need.
Hello, Grace speaking.
Nurse Grace Curry tells Jessica's worried mother in Chicago that her daughter will have to stay in hospital.
Especially since she's staying in student accommodation by herself, I think it's more likely that we'll keep her overnight for longer, just to make sure that we're not sending her home by herself to no one.
Jessica's still in danger of having another seizure, so hospital staff need to monitor her overnight.
People can die from a seizure, especially if it's a prolonged one, and that's not recognized. Because sometimes you can stop the actual body convulsions, but there's still abnormal activity going on in the brain if you don't wake up.
After suffering 3 potentially fatal seizures in one day, Dr. Michelle's patient, exchange student Jessica, was kept overnight for observation.
Can you tell me what medication you're on for seizures? Do you know?
The next morning, Jessica remembered she missed taking prescribed medication before the seizures. She was discharged the next day and has returned home to Chicago. Friend Sarah is continuing her studies in Melbourne.